Back here now, Congressman Richard Neal visited the Berkshire County city of Pittsfield earlier today, meeting with healthcare officials.
22 News reporter Claire Overton joining us live in studio with what was discussed at the panel.
Nick and Sierra, healthcare officials gathered to hear challenges, but also what is being done on the federal level.
I've not given an inch on our hospitals.
Congressman Richard Neal meeting with healthcare providers and officials in Pittsfield to discuss the climate of healthcare in the United States. The one piece of legislation that drove the conversation stems from President Trump's One Big Beautiful Bill. And while most of the items in the bill are not set to take effect until after the midterms in the fall, many are already being felt, especially in the hospitals.
75% of their revenue comes from Medicare and Medicaid. Medicare is the biggest employer in Massachusetts.
But Medicare and Medicaid are being hit hard through the bill, including around $1 trillion being cut over the next 10 years. And also, the eligibility is changing.
For folks that are at the lower end of the pay scale, so think of somebody, say, below $35,000 a year, $40,000, they're no longer eligible for Medicaid because they're not making enough money.
One of the bigger challenges that Berkshire Health Systems is facing is the changes to the application process and retention for Medicare and Medicaid through One Big Beautiful Bill. Rodowitz said they have a program called Advocacy for Access that ensures that people are up to date with all of their paperwork for Medicaid. But now, instead of renewing every year, it has to happen every 6 months.
Essentially, what this bill is hoping for is a few months of not having to cover anyone. Well, when they come into the emergency department, they're still getting care, except for now there's no payment. I will transfer that ultimately, some way, to the commercial payers.
So these changes are not only impacting the hospital system and the individuals who are losing their coverage, but also others who in turn need to pay more.
And Claire, hard times for many hospitals across the country, which are either shutting down or dealing with financial struggles.
Yeah, and despite these hardships, there was one shining light during this panel, right?
That's right, Nick. Both the congressman and the Berkshire Health System proudly said that despite all the struggles going on back in 2024, they were successfully able to reopen North Adams Regional Hospital. And a hospital reopening in this climate in the healthcare system is very rare right now, so it's definitely a glimpse of light looking forward to the future.
Yeah, some good news there. Claire, thanks.